Good evening, Miss Sahar. My name is Paola. I'm going to be the nurse taking care of the discharge teaching of breast care and breastfeeding. I would like to begin by discussing the importance of nutrition. The food that you eat directly impacts the quality and composition of your breast milk. That's why it's so important to consume a variety of nutrients-rich foods. This way, you ensure that your babies receive a variety of essential vitamins, minerals, and other nutrients that are necessary for their growth and development. It's also important that you maintain adequate calorie intake because obviously breastfeeding requires a lot of extra energy on your part. So it's important to consume enough calories to meet your body's increased needs. And in regards to hydration, it's important to stay hydrated because this is gonna ensure that you have adequate milk supply. So drinking plenty of fluids, especially water, helps to prevent dehydration and ensure that your body can produce enough milk for baby. That's in regards to diet. Now, I will also like to start talking about colostrum. I'm not sure if you remember this back from the previous experience you had with your other baby, but colostrum plays a vital role in providing your baby with essential nutrients, immunity, and antibodies. So it's important to start the breastfeeding journey with the colostrum. At first, you're gonna notice that colostrum comes in very small quantities, and the reason why that happens is because your body's so smart. Your body knows baby, and baby stomach, it's so tiny, so it can only hold so much. That's why it produces a little bit of colostrum. That doesn't mean that it doesn't have all the required nutrients for baby. Actually, it's perfect for baby. And usually it could take between 3 to 5 business days for the actual breast milk to come out. So my recommendation to you is to begin and to give as much you can to baby colostrum. I'm gonna show you how to express your colostrum. So what you're gonna do is you're gonna put your hands like this, and then you're gonna do like this. And this will help you to express colostrum. And I recommend that you give as much as you can to baby because, as we already talked, it has so many nutrients. It provides passive immunity to your baby, so baby can have it can have the strength and the antibodies to fight against infections. So this is very, very important. And then now I would like to talk about actual breastfeeding. So in regards to breastfeeding position, I want you to make sure to position your baby's mouth at the level of your nipple and areola to ensure a good latch and prevent nipple soreness. That to begin. Then the latching technique is also very important. I recommend that you encourage your baby to open their mouth wide before latching. And aim for a good latch, deep latch, where your baby can actually take a good amount of your breast tissue along with the nipple. And this will help with effective milk transfer. As far as the frequency for breastfeeding, we should aim to breastfeed at least 8 to 12 times in a 24-hour period. This will help establish a milk supply and keep your baby well nourished. As we talked about, at first you're gonna see colostrum, which is perfect for baby. My recommendation is to keep track of which side of the breast, which breast you gave baby colostrum and for how long. So for instance, I'm gonna give you an example. Let's say you started today, right now, 5 minutes ago, and you started giving colostrum to your baby and you did it for 3 minutes on the right side, right? So for next time that you have to breastfeed baby, you're gonna start with the opposite breast and you're gonna aim to do the same amount you did in here, So if you did 3 minutes here, you're gonna try to do 3 minutes here. But then if, let's say, baby went over the 3 minutes and baby went over 5 minutes, then you're gonna start next time with this breast and you're gonna do 5 minutes. So this way you're gonna ensure that there is a same supply coming out of both of the breasts and same frequency and same amount. So we're gonna try to do that as well. In regards to breast care, after each feeding, I would suggest that you gently pat your nipples dry with a clean cloth. And you can also apply a lanolin based nipple cream to keep the moisture and prevent cracking or soreness. As far as the breast engorgement goes, if you experience that your breast is like engorged a little bit, we can also apply warm compresses or take a warm shower before feeding to help out. Or you can also hand express or use a breast pump to relieve some milk before latching baby, because that might happen at the beginning because of the experience of breastfeeding and stuff like that. And in regards to breastfeeding positions, I recommend that you try to experiment with different breastfeeding positions to find the one that works best for you and your baby. Some common positions include the cradle hold, the football hold, and sideline position, which I'm gonna show you in case you don't remember this. I'm gonna show you a presentation after, so then we can ensure that you know the proper breastfeeding positions. And then as far as signs of effective feeding, because of course you want to make sure that you're doing effectively for both you and baby. So you can look for signs that your baby is getting enough milk, such as, you can hear that baby is swallowing, it's active sucking, and it's actually good after the feedings. Also, the best way to measure if you are doing an effective breastfeeding is checking the wet diapers. So your baby should have at least 6 wet diapers and 3 to 4 bowel movements per day. That's gonna be the best way for us to keep progress of that. And in the first few days, your baby might only have like small amounts of colostrum, but this is normal and provides important nutrients and antibodies like we have talked about. So that's okay. And if you feel like you need more information, that you need more support, we can also direct you to our lactation consultant or breastfeeding support group in case you need any additional help with breastfeeding. I hope this was helpful for you.